So good evening, friends. One minute. So very good evening, everyone. So let's continue our class, and we are discussing that how can we treat COVID virus with the help of acupuncture, and we are learning scientific explanation done by many hospitals. So let's do a little recap. There are many viruses. There are many viruses available all around. Like virus of common cold, like virus who create respiratory problems. There are many viruses and create respiratory problems. The virus who create multiple types of influenza. Then we are running with a running nose, blocked nose, cough and cold and all. Out of these all virus, we are having 7 types of coronavirus. And the coronavirus is attacking on the human body not from last year, but the coronavirus attacking on the human body since many decades. But all species of the corona are not that much dangerous like COVID-19. So there are many viruses. They are called SARS. The meaning of SARS is who is creating severe, acute, respiratory disease. So they are called SARS-CoV virus, or we can tell SARS-CoV. And these viruses attacking on the human body since many years. Like in the 2012 also, this virus has been detected. Right now, the virus which is called SARS-CoV-2 or COVID-19. The meaning of SARS here is severe acute respiratory disease. And this virus is causing infection and attacking in the body. In the acupuncture, what is infection? In the language of acupuncture, infection is bind. So attack of any infection. But in the acupuncture language, we are telling it attack of bind. Sometimes some different virus is attacking. Suppose this is the virus 1 and creating some problem, creating running nose, cough and cold and all. So body, as soon as virus is attacking on the body is reacting and causing some symptom like blocked nose, tonsils, adenoids, enlargement, sore throat. These all are symptoms created by the body. And body is giving us message, now virus has reached at this level. Because at each and every stage, body is giving us message. By understanding that message, we can treat the virus. The thing is this, either this is the virus of 2012, or it is the virus of 2008, or it is the virus of 2002. We have given different name like MERS, SARS, SARS-CoV-2, and many other influenza virus. So whenever any virus is attacking in the human body, and this is the human body. So first this virus is going in the nose by air, then going in the pharynx, larynx, then going to the bronchi, lungs. This is the first stage that virus is entering in this part. Or we can tell the infection is entering in these parts. So there are lots of symptoms created by the body in the nose, in the pharynx, in the larynx, in the bronchi, in the lungs. And after that, virus start going in the deeper level. So when virus is trying to enter and trying to do infection, we are telling it in the TCM language, the attack of bind. In the TCM, it is clearly explained that bind is doing 8 types of attack. That's it. So there is a 8 way to infect human body. So this is called the fighting of virus. So this can enter like this: 1, 2, 3, 4, 5, 6, 7, and wait, there is total 8 method this virus is attacking on the human body. So whenever this virus is attacking in the human body, the first layer who is getting affected, the outermost defensive system of the human body, that is called Tai Yang. Taiyang is the outermost covering. Or we can tell greater yang, Taiyang or greater yang. So there are 8 ways to attack on the human body. So the virus is attacking on the outermost shield, then entering on the second level, that is called Yang Ming. So we can consider these two levels, 1 and 2, are creating the defensive shield. Defensive shield. Like this is our kingdom. This is our body kingdom. This is our body, or this is our kingdom. And we have created 2 layers of defense. The outer 2 layers of defense. So the outermost layer is Tai Yang, and second is Yang Ming. So first virus has to cross these 2 outermost defense layers. Then virus can enter inside. And it's not easy for the virus to cross these 2 defense systems. Now, if we talk about the total defense system, so we are having total 6. 6. So virus is penetrating 1, 2, 3, 4, 5, and 6. Finally, it is reaching on the deeper level. But it has to cross one by one 6 defense, 6 layers to reach inside. And the most important is 1 and 2, because which is the outermost. And they are very powerful. Our whole body gives 100% to defend the virus at these 2 levels. Outermost is called Tai Yang, and second is called Yang Ming. So on the one side, we are having virus. On the other side, we are having our Tai Yang, number 1 defense system. And Yang Ming, number 2 defense system. And virus, either this is the common cold virus or influenza virus, or this is the virus of pneumonia, or it is any bacteria or any other types of infection. If want to enter in the body, then have to cross these 2 defense systems. And we are having a strong defense system, then virus can't do anything. Because we have designed, the human has designed in this way, so that he can live in this kingdom, in this earth. We have been designed in that way, so we can live comfortably on this earth. Because virus is not from last 10 years or 20 years. The viruses are, bacteria are since this universe, this earth, our existence started. So we started our life, even virus has started their life. But we have designed in this way that we can fight with the virus, and we can fight it. So if we are exposed continuously, then we will develop the antibodies to fight with the virus. And if we want to live in this earth, then this is the mandatory task that we should develop the antibodies. Otherwise, it's very difficult to survive. So now, this virus is attacking on this defensive system, and we will shortly discuss what it is doing then. But you know why COVID-19 is more common in men? Why COVID-19 is more common in male? It is not that much common in female. It is less common in female. And this is the true fact. But right now, either you get the attack of influenza, you get the attack of different types of pneumonia, you get any different types of virus attack. And if you go to the hospital, they will declare it COVID-19. So since the COVID-19 has appeared, we are not seeing any other virus. So all the other virus has gone for holiday? No. So some of the person are getting attacked by COVID-19. Some other viruses are getting attacked by other viruses. Because other viruses is still on. They are not on the holiday. Now since the COVID-19 is there, we are listening only death, illness because of COVID, COVID. Where are other viruses? So the thing is this, but this is the fact, that if you go to the hospital with the cough and cold, with the sinus, with the pneumonia, immediately everyone declare that you are suffering with the COVID. You may be suffering with the COVID and you may not be suffering with the COVID. But you can't understand and we can't understand the system of the hospitals and all. Because if we are in the fear, then we can spend more money. If you know, oh, you are suffering with the COVID-19, then you are ready to spend lakhs money. But you know, if you are having simple common cold virus, then you don't want to spend more money. And no, any hospital want that. So, if we talk about the COVID-19, so COVID-19 is more common in male. I'm not talking about the corona, because there are 7 types of corona. Some corona is very simple. It is not creating any more illness. Some corona attacking on the stomach and gastrointestinal tract, creating some digestive disorder. And this corona, this is COVID-19, SARS-CoV-2. Which is more common in male. Do you know the reason? Anyone know the reason? Why common in the male? So the reason is this. If we do the comparison of male and female, if COVID want to enter, or not only COVID, there are many other viruses. When they want to enter in the body, they need the door to enter. If you don't have door, then how will you enter in the room? So this is the door of male, And this is the door of female. The meaning of door means alveoli. Alveoli. The meaning of door means this door is in the alveoli. Because ultimately virus has to attack on the alveoli. When we are taking breath, this breath is going in the nose, then going in the air pathway, means pharynx and all. Then finally this air is reaching in both lungs. So this is the right lung, this is the left lung. In the lung, we are having multiple branches, multiple branches. The all branches are called bronchus. And finally, at last, we are having one balloon-like structure that is called alveoli. Alveoli is like a balloon. This is the alveoli. Or we can tell air sac. So when we are doing breathing, we are inhaling the air. Finally, this air is going inside the alveoli, and alveoli is full with the air. Sometimes we are suffering with the kapha. Then some kapha deposited inside the alveoli. Then we feel little bit difficulty, and we are doing the expectoration of kapha. We are doing expectoration of kapha with the help of this alveoli. So sometimes, like in the pneumonia, there is a kapha deposition in the alveoli. The alveoli has been designed for air, but there are many bacteria, there are many viruses, they are creating little kapha, little phlegm inside the alveoli. Then some person feeling some difficulty in breathing. And this alveoli has made by the multiple cells. The name of this cells is called pneumocyte. So alveoli is made by these cells. Now, now what is happening? Suppose we take one pneumocyte. We are taking one pneumocyte. This pneumocyte having one door. From this door, this virus can enter. COVID-19 can enter. From this door. So each and every cell having multiple doors. So if we talk about the males and we talk about the females, if we take the pneumocyte of the male and we take the pneumocyte of the female, or we can tell alveolar cell of male or pneumocyte. This is also pneumocyte. So if we talk about the male, we are having multiple pneumocyte. No, sorry, multiple doors. But in the female, we are having lesser doors. So the COVID virus is entering from this door. So that's why male are more prone to get these types of infection. Not only COVID-19, there are many other viruses are entering from this door. And this is more in the male. The name of this door is ACE2 receptor. The meaning of ACE2 receptor, the door where COVID virus can attach and can enter. So nowadays, what scientists are thinking, scientists what are thinking, okay, they are trying to develop the medicine so that they can close the door and damage the AC receptor. This is very dangerous because this door has been created for some purpose. So if you damage the door, okay, then no entry of the virus. But there is some purpose because this ACE2 receptor is responsible for many good things. We'll discuss shortly after some time. So right now, my concern is to tell you this ACE2 receptor means angiotensin converting enzyme 2 receptor are more in the male. And second thing is this ACE2 receptor also available in testes of male. So that's why male are more prone to get this infection. But male, female both can get this infection because both are having this receptor, more or less. So there are many person who is taking some different types of medicines. These medicine like written in these medicine in the last written pril, P-R-I-L. If we see the medicine, any medicine in the last, if it is written pril, benzopril. So these medicine are creating more ACE2 receptor. So these person also having more chances to get the infection. Okay, so this was a little concept why male are more sensitive. So coming back to our previous concept, so when there is a fight is going on, so these are the two different levels. The young and young men, they are fighting, trying to stop the virus, bacteria outside. So there are 8 different types of pattern. There are 8 different types of infections, and body is creating the symptoms at each and every step. So I told you, bind means infection, or we can tell infection has been considered as a wind. So now, out of 8 patterns, the pattern number 1 is called the attack of virus on outermost defense system. Or in the other word, we can tell the attack of wind cold. The attack of wind cold on our defense system. So as soon as this attack will happen, so body will create some symptoms. So in this pattern, we can divide this pattern in 2 parts. Number 1, attack of external wind cold, attack of external, wind cold. Same thing I have written. In the first condition, cold is plus plus. In the second condition, wind is plus plus. So these are the two patterns, pattern number 1 and pattern number 2. So as soon as you're feeling something, oh, my neck is stiff neck. Oh, pain on the back side of head, pain on back of head, running nose or blocked nose or body pain. So these signs can be considered as a primary sign of any attack. So in this condition, we know we don't like air, we don't like cold. So in these all conditions, like these are the conditions just of primary attack, very primary attack, the first symptoms. And as soon as we get little bit, like some body pain, little myalgia, some body pain, running nose, blocked nose, body pain. Oh, I don't, please switch off the fan. Oh, I don't want, give me some blanket. So these are the primary sign of any types of attack. Either this is the normal attack of the common cold or this is the attack of SARS COVID virus or SARS COVID-2. So as soon as we get this attack, we should be aware, oh, this is the attack on our outermost covering, means the yang, means SI and UV. So if there are two patterns I told, in the one pattern, cold is plus plus, in the one pattern, wind is plus plus. Because this is the attack of wind cold. Wind cold. But in the first pattern, cold is plus plus. So if cold is plus plus, then because of more cold, there will be no sweating. Because of excessive cold. But if there is a wind, then little bit sweating will be there. So these are the very primary signs. So we should find out. In the normal language, we are telling this, oh, this is the normal influenza. And right now we don't know whether this is the normal influenza or COVID. Just we have to wait and watch. Even you do reports, you will not find anything. For 2 more days, you won't find anything in any report because the incubation period of COVID is 2 to 14 days. So we will find something after 2 to 3 days now from the attack, day of attack. So in this condition, if some patient is coming like that, so we can treat immediately. Number 1, expel, wind, cold. Expel, wind and cold. How can we do that? In our acupuncture, we are having lung 7. Lung 7 is the Leo connecting point of lung. So some virus is having intention to attack on the lungs, it will transfer the energies from the lungs. So we'll set it. It is very good point to expel the wind. Large intestine 4, we will sedate it. This is the source point of large intestine. And urinary bladder 12. These 3 points always remember. If you feel any types of little bit attack, just sedate these 3 points. Just do the vigorous acupressure as these 3 points. As soon as you sedate these 3 points, you will able to expel the attack. Let's see the location. So first we can see the location of bladder 12. Look at in this image. The bladder 12 point is that much effective. Like suppose if you know the cupping therapy, and if you are well aware with the cupping therapy, and there are 2 types of cupping. One just normal cupping, put the cup. So one is called normal cupping, one is called blood cupping. So put the cup in this area randomly, forget the point. Put the cup in this area for some time. Very excellent treatment. Or take the pen like that. This is called gua sha, Chinese spoon or gua sha. And do the scraping on the urinary bladder 12 area till it become red. Even you can take Chinese spoon, which, or you can take this spoon gua sha. So do the scraping here on this area just after finishing the neck. Our most important point is UV12, or you do cupping, just put the cup, because this is the cup. This is the cup, but we have to use silicone cup and put the cup with the suction pressure. So we can stir the cup on the urinary bladder 20 on the back. Or the most important, if you take out some drop of blood, finish. If you take out some drop of finish, infection finished immediately. The virus has attacked and created some toxins, but we have removed everything from the urinary bladder 12. So let's see the location of urinary bladder 12 here. In this image, we can see so look at, this is cervical vertebrae. These are the cervical vertebrae. One minute. So these are the cervical vertebrae. And as soon as cervical vertebra completed, this is the starting of thoracic vertebra. So this is the thoracic 1. This is the thoracic 2. So if we see the location of bladder 12, The bladder 12 is just below the thoracic 2. And from the center, it is 1.5 chun away. So we can measure with the help of 2 fingers. This is the 1.5 chun. So let's see the other image. Look at this image. So this is the ending of cervical vertebra. So here we are having thoracic 1. Here we are having thoracic 2. And just below that, from this gap, if we go 1.5 to lateral, that is the location of bladder 12. And when we do the cupping at this area and take out some drop of blood, so do the blood cupping. It is an excellent treatment for all types of infection in the first phase. Or we can needle it, we can sedate it with the help of needle. So in this way, the second point, Li4. The Li4 is the very excellent point for all types of infections. Between the first and second metacarpal bone, just between this part, this is the location of Li4. Look at in other image. Look at in this image. So this is the first metacarpal bone. This is the second metacarpal bone. In between we are having this muscle. The name of this muscle is interosseous muscle. And we are having Li4 here. If you look at my hand, so look at my hand. So we can see this protruded muscle is here. This is the interosseous muscle, just midpoint, that is Li4. Li4 is the excellent point to prevent any infection. So put the needle here, or you can sedate the Li4 in the sujok. This is the second point. And the third point, which I told you, LU7. The LU7 is the great point for any lungs problem. Any attack in the lungs, just take LU7. So normally there are many persons, they are putting the star cluster magnet here. The cluster magnet here. From the wrist crease, if we go 2 finger or 1.5 chun proximal, this is the location of LU7. We can also measure in this way. If you keep your hand like that. Oh, sorry. You look at my hand, then I will share the screen. If you keep your hand like that, sorry. So this is the location of LU7, or better idea, feel this depression. From this depression, if we go 2 finger, so this is the location of LU7. The LU7 point is in the yin-yang junction. This is not this side. This is not this side. This is on the border, on the yin-yang junction. 2 finger down or 1.5 chun down. This is the excellent point for all lungs disorders if they are infectious. If they are infectious, you sedate this point. Wonderful point. Just by doing the 3 points, you can expel the wind immediately. So as soon as you feel a single symptom, do the sedation of these 3 points. LU7, So from the wrist crease, if we go 2-finger proximal, put the cluster magnet here or put the sedation magnet here or do the needling here. Li4, UV12. And whenever you find someone in your home or your patient telling you, maybe I am having some sinuses, normal cough and cold, not cough and cold, simple running nose or blocked nose, just starting. You do the expel the bind by using these 3 points. Okay. So whether these points are enough? No, we will use few more points. Now, point number 2. Still we are working on this attack. The 2, because of this attack, person is feeling occipital headache. Occipital headache. And neck pain. So whenever someone is suffering with the occipital headache or neck pain, we have to remove the bind from this area. Remove the bind, or we can tell, remove the infection of bind cord from this area. So right now we are removing the bind from this area. How can we remove? We are having excellent point, governing vessel 16 and gallbladder 20. The governing vessel 20 and gallbladder 20, these 2 points are very good for expelling the wind from the head. Let's see the location of first governing vessel 16. The governing vessel 16 point, even very famous in the Marma science. And this is the best point to remove the wind from the head. So look at this image. If you look at this image, here we can feel this is the skull and this is the neck and this is the junction of skull and neck. On this junction, we can feel the pit here, one pit here. That pit is nothing but governing vessel 16. Even if we press the pit, we can feel the depression on the backside. We can feel the pit, but don't pressurize it very vigorously because this is the Marma point. And we are needling this point, little needling, half chop. Many persons are very much scared with this point because they think, oh, medulla oblongata is there. Don't worry. Your even 1 tube needle will not reach till the medulla oblongata. Even more than 1 tube needle are not reaching there. So half tube insertion is absolutely safe on the governing vessel 16 because this is a very good point to expel the wind from this head area. So the person will feel lightness in the head. Not only because of this virus, if someone is having sudden air attack, sudden anything, while some wrong eating, some wrong types of traveling in the air, even these all conditions, we want to remove the headache and remove the wind, so we can use this point, governing vessel 16. So governing vessel 16 is very famous point. We can see in this image the location of governing vessel 16. So we are having 2 points to expel the wind, 1 point in the back side and 1 point in the lateral side. So let's see the point of lateral side. So look, 1 minute. Sorry. So one point we have just seen here. Both the point in the backside only. So one point just we have seen here. And one another point just on this line, both the side, near about 4.5 tune, 4.5 tune. But don't forget the 4.5 tune here. Just you can feel the depression. I will show you other image. So look at this image. In the backside of skull, in both sides, we can feel the depression here, little depression. If you take your finger here, we can feel the depression. So this depression is gallbladder 20. So we can put the point in this depression. Let's see in another image. So look at this image. So in the center, we can feel, in the center we can feel the governing vessel 16 and both sides we can feel gallbladder 20. Even we can do the acupressure. Even we can put these points in the sujog, and we can put the body, we can do the body acupuncture. These are the absolutely safe point. The gallbladder 20 is absolutely safe point. So this point will release the wind from the head. These 2 points. So we are removing the virus effect step by step from each and every body parts. So these 2 points. So expelling the wind from head. So this work done by these 2 points, by doing sedation of these 2 points. Now, the third thing, because the intention of virus to attack the lungs, so we will take the Baxu point of lung. That is UV30. And UV30 is the Baxu point of lung. And we can do the bloodletting, or we can do the sedation, or we can just put the needle or magnet, or we can do the acupressure, or we can do the gua sha, which I told you, gua sha. So ultimately, we have to stimulate the urinary bladder 13 point. The urinary bladder 13 point is the Baxu point of lung. Without the urinary bladder 13, our protocol will not complete. So when we are doing the bloodletting, or when we are doing the gua sha or scraping on the urinary bladder 12, we are covering the 13 point on the same time. Because with the help of 12, we are expelling wind. And with the help of 13, we are working on the lungs, removing unwanted deposition, inflammation from the lungs. So doing the sedation of urinary bladder 13. Like in the traditional acupuncture, we are studying this very properly. What? The relationship of the lungs with the other organ. The lungs with the other organ, like for example, kidney. The normal direction of the lung energy, normal direction of lung chi is downward. So When lungs is sending the energy downward, downward means lungs is fine. But when lungs is stopping the sending energy downward, then energy remain or left. So chi left in the lung and creating problems. So as soon as we are sedating the backsupport of lung, we are doing the urinary bladder 13 sedation, which is the backsupport of lung. It is doing descending function. Because when virus is attacking, it is disturbing the lung functioning. And lung is unable to send the energy downward after the attack of virus. But we are doing with the help of this urinary bladder 13. So step by step, we are creating all the things which problems created by the viruses. Now, this is very common to create the infection in the nose. This is with the research, this has been proved that ACE2 receptor is also found in the nose, even in the mouth. So virus is creating lots of problem in the nose, like blocked nose, runny nose. Now, we are clearing the nose while large intestine 20 and governing vessel 23. We are sedating these 2 points. Large intestine 20 point found just on the side of nose. If we understand this concept, then we can treat each and every types of viruses. So look at this image. On the both side of nose, we can see here the depression. We can see the depression. If we praise this point is called anti-histaminic point. Means with the help of this point, we can improve the lungs, we can remove the inflammation. So the Li20 point is very much useful for the infection in the nose. So we are inserting these points. And with that, we are choosing the governing vessel 23. The governing vessel 23 points are on the scalp. So governing vessel 23 point near about little back from the hairline. If from the hairline, so this is the hairline. From the hairline, we go one chin back. This point is governing vessel 23. And this is the very good point for the nose. When we learn scalp acupuncture, we are using this point for the nose. Right now, we should understand that if someone is suffering with any problem of the nose, even after the attack of COVID-19, someone lost the smell, then we are stimulating this point. Why this point is very useful? Because this point is available on the scalp, and the points over the scalp are very much useful for the nervous system disorders. So the governing vessel 23 is one chin back from the hairline. So this is the hairline. If we go one chin back, near about 1 inch back. So this is the point, governing vessel 23, which is very useful for nose. So Li20 and governing vessel 23, these 2 points, we are clearing the nose. Even we can use this point independently. If someone is having little bit something in the nose, just use 2 points, Li20 and governing vessel 23. So this is the Li20 and governing vessel 23 are very much useful. We are coming for the chest congestion. See, the chest congestion, right now we are discussing influenza phase. Influenza phase means person is telling, oh, I got sardi, mujhe sardi ho gayi hai. The chest congestion will come in the pneumonia phase. We are going to discuss that in detail, don't worry. Okay, question. The cream after blood cupping. Okay, so you can use thrombophore. Thrombophore cream. This cream can be applied after blood cupping on the cupping area. Or those who are not familiar with the blood cupping, they can do dry cupping. And just do the guasa with the help of this Chinese scoop, Chinese chammach. Very excellent. Now the thing is this. On the top of the scalp, we are having one master point that is governing vessel 20. So we are using this point because this point is also relieving the headache. So finally, our protocol will be like that. Number one, we have two conditions. Attack of external wind cold. Cold is plus plus. If cold is plus plus, then no sweating. Other symptoms will remain same. Second, attack of external wind cold. Wind is plus plus and slight sweating will be there. So here, because of cold, there is no sweating. And I told you LU7, Li4, urinary bladder 12, then urinary bladder 30, gallbladder 20, governing vessel 16, governing vessel 23 and Li20. These are the points. Same point will be here in both the condition. And we have already discussed by these points. Now, on the first condition, because no sweating, so we will create the sweating because we know if we create the sweating, then person feel very good. How can we create the sweating? Which are the points are very good for the sweating? So creating the sweating, so that for creating the sweating, we want to open the pores. So the kidney 7 and Li4, the tonification of the kidney 7 and sedation of the Li4 will start sweating. So with the help of these 2 points, we can start sweating. Li4 we already taken earlier. So just we have to add 1 point, that is kidney 7, tonification. So we are doing the sedation of all point. Just we are doing tonification of kidney 7. If you don't want to do tonification or sedation, just do the even method on all the points. That is also enough. Now, in the second thing, because slight sweating is there. Slight sweating. So what is the meaning of sweating? The meaning of sweating, we are having 4 levels. Outermost level is called defensive key level. Second level called key level. Third level is called nutritive key level. And fourth level is called blood level. So we are having 4 level of defense. This is one other classification. As per this classification, first virus is attacking on the defensive system. And when virus is winner, then reaching to the next level, then third level and the fourth level. The third level is called nutritive chi level. The nutritive chi level means giving the nutrition. So if sweating is there, sweating is the sign that nutritive chi level is not in harmony. So we are having certain points to bring it in harmony. So when someone is having sweating, like this patient getting slight sweating, then we are adding 2 points to bring the harmony in nutritive chi level. For harmony in nutritive chi level. These points, stomach 36. Do the moxa or do the tonification. Stomach 36 is a very good point to harmonize the nutritive key. And do the tonification of urinary bladder 18. This is also harmonizing our nutritive chi. So finally, if someone is suffering with common cold and no sweating, and someone is suffering with common cold with slight sweating, so this is the first level of viral attack. And just why? Using few points, LU7, LI4, UV12, UV13, gallbladder 20, gallbladder 16, Li20, governing vessel 23, and kidney 7. Set it all point, just tonify kidney 7. On the other side, if slight sweating is there, then tonify stomach 36 and UV 18. Other point will remain same. So this is the summary of 2 things, because I told you there are 8 types of attack. And right now we have discussed 2. Wind cold, and cold plus plus, and wind plus plus. Slowly we will go in the pneumonia phase. Right now we will discuss influenza phase, common cold phase, external attack phase. Then we will go to the pneumonia phase. Then we will discuss severe illness, critical illness, life-threatening illness caused by virus. So enough for today. अब हम थोड़ा सा ब्रेक करते हैं, फ्रॉम हिंदी की क्लास चालू करेंगे. ऑलरेडी 9:30. ओके, तो 5 मिनट का ब्रेक करते हैं, फ्रॉम हिंदी की क्लास चालू करते हैं. और अब हम कल मिलेंगे, कल भी हमारी क्लास होगी. सो वी विल मीट टुमारो. We will meet tomorrow. From Monday onwards, we will do the class for enrolled participants. But tomorrow I am going to discuss with you very good information. So even those are just for tomorrow, they will learn something very new. Okay, so see you tomorrow. और जो जिन लोगों ने ऑलरेडी इनरोल कर लिया है उनके लिए क्लास चलती रहेगी, और इस क्लास के बाद आफ्टर दिस क्लास यू विल एबल टू ट्रीट each and every types of respiratory infection, either this is a common cold, lung problem, pneumonia, bronchitis, anything, critical illness, all these things. So thank you so much. अब हम 5 मिनट का ब्रेक करते हैं, फिर हम हिंदी में मिलते हैं.